Assalamu alaikum, Bismillah ar-Rahman ar-Rahim. Back to the basics. This is a case of old man, all right, came with macular cataract, pseudoexfoliation syndrome, as it could be seen here, and mid-dilated or not well-dilated pupil. Well, I've taken the decision to go for extracapsular cataract extraction. First, started with the main wound using the keratome, and next injection of the pigment. As you've seen here, the anterior capsule was stained. Injecting next, wash the pigment, okay, with BSS. Next, heal on, and now it's time for a can opener. You start from 6 o'clock all over around, scratch by scratch, until the final one, and then to be continued all over around together. So we achieve the anterior capsulotomy. Removing the anterior capsule, symmetrical cataract, and here we have a risk of zonular dehiscence and instability as well. So injecting a little bit of Healon, and do not overhydrate. Just minimal, gentle hydration to move the cataractous lens. Before doing that, just widen the wound. Main wound should be widened. Using keratome, side to side. As I've learned, I don't use scissor. Now, as I've explained earlier, gentle dissection. As you see, there's instability. So gentle movement. Now, nucleus delivery. As long as you have good rhexis and generous wound, so it will be delivered easily. As it could be seen here, it's almost parent cataract. Now injecting more Healon. Check the bag stability, and secure the main wound. And the next step will be the IOL implantation inside the bag. Suturing the main wound with 10-0 nylon. I start by the side. Usually the first suture will be at 12 o'clock. However, I get used to just secure the periphery and then go to the center after implantation. However, I will do the 3 sutures in the center since it's foldable IOL, so there's no bothersome. The first suture, the first lock, is very important. Once the first lock have been tightened, so the second and third knot will be easy. Proceeding for suturing. This process takes time. Not too much tight suture, not too loose suture. Pairing suture once you have finished the last node, so it will be easily paired. Well, next proceeding to the second suture, and always catch between the 2/3 and 1/3, and follow the contour and the curve. It will be easier without pushing too much on the globe. And be sure that before suturing that you inject Healon. It helps a lot. And won't be full thickness. It will be partial thickness, alright? You can take it one bite or one by one layer. Again, the first lock and the second and third. And bear in mind, so you can see the suturing process clear, you have to zoom out. So every time you are working, you need a specific setting for each step. It's very important. Mastering the microscopic handling is the first thing, and one of the most important and challenging things for the beginners. Well, here using Simcoe cannula and clearing all the cortex and smattering the anterior chamber. And next, if you are planning for the implanting PMMA, this is the type of IOL using with the extra cap. So implant first and then secure the 12 o'clock suture. Here we have the foldable, so I have taken the decision to continue suturing and then implanting the foldable IOL in the back. So the next step, continue to check the anterior chamber stability, close as if you're or you have finished it. Okay, and then prepare for IOL implantation. And this is the foldable IOL using the injector, slowly injecting, and then bring the dialer and try to dilate, reposition it inside the pack. Check that the IOL inside the back. Okay, hydration. Check the anterior chamber staple, or you might need another suture. So here I need the fourth suture. Inject more healing. Good focus. Zoom in. Take your bite. And then continue suturing as we have done in the previous sutures. Enjoy the rest of the video. Thank you for watching.